Oh, ain't nothing wrong, okay?
Good evening, and welcome to the Black Scientist Cooperative Podcast. This evening, we'll be talking to Charlie McMurray-Horton, who is the Administrative Director for Nursing Strategic Initiatives. And one of the main reasons that we're talking to Charlie tonight is because May is Mental Health Awareness Month, and we want to make sure that we are bringing you as much information as possible as it pertains to our communities and how we can better facilitate our mental health. So Charlie, if you wouldn't mind starting us off with a little bit about yourself, how you came to be the administrative director for, nursing strategic initiatives and what that path looked like before we get into our topic.
Absolutely. So I have been a nurse over 30 years. And I actually came from a family of nurses. My mom was an LPN. I'm from Oklahoma. And during college, some people know exactly what they want to go into, some people don't. So through my college career, I went from wanting to be a physician to a PA, to a physical therapist, and I landed on nursing, back to where I was supposed to be in the first place because my mom always wanted me to be a nurse. Now, the unique thing about nursing school is you get exposed to various types of nursing, from just the general med surg nursing to OR nursing to pediatric nursing to psychiatric nursing. And when I had my psychiatric nursing rotation, I instantly fell in love. I was in a facility and worked with children and adolescents and went straight into child adolescent psychiatry when I graduated. And I have been there in some form or fashion ever since, from being a staff nurse to being an educator, to being over units from geriatric all the way back down to a child as young as 5 years of age. So the whole gamut of psychiatry services I have been a part of, from inpatient to outpatient, residential treatment facilities, that's just my passion. I've stayed there from day one and have continued to seek out experiences and grow with mental health. What brought me to Texas is I actually was the director of Bentob Hospital's mental health services, which included psych emergency services, inpatient services, and outpatient services. And I kind of evolved into the point person for the Harris Health System in regards to behavioral health. That being said, I'm really proud that Harris Health is one of the integrated healthcare facilities when you talk about co-locating mental health services with physical health services, because there's truly no health without mental health, right? So Harris Health, being the third largest public health system in the country, actually is fully integrated with psychiatry services in their primary care settings, in some of their pediatric clinics, as well as both of their pavilions, whether it be their inpatient unit, psych emergency services, or consult service that helps with patients in the medical setting. So that's how I got to where I am now.
So as the Director of Nursing Strategic Initiatives, what does that look like in the realm of Harris Health, and not only Harris Health, but in mental health? And what strategies or initiatives are you spearheading to get us better mental health?
So this position actually reports directly to the Chief Executive Officer, and the goal of the position is to help implement nursing strategies across the system in conjunction with Bentob, LBJ, and ambulatory care services leadership. When we talk about behavioral health, what we've identified, especially even more through COVID, we already knew it was an issue, but COVID just magnified it. the amount of individuals who are needing mental health services is growing twofold. It's just tripling and over. And what we found is that our staff, in order to be able to really care for those patients efficiently and safely and provide quality care, they need some additional education, they need some additional support, some additional structures. So one of my tasks in this role has been to develop a crisis intervention team, which actually is starting in our emergency centers, but will be a team that helps that emergency room staff in managing and meeting the needs of patients who present with psychiatric issues or concerns.
Wow, thank you, Charlie, for that. And thank you for being here today. One of the things that I think would be important to understand, and if you can help our audience to understand, is because you've used the term mental health. And again, May is Mental Health Awareness Month, but can you help us to understand how mental health is defined?
So, for us, me and you and people who feel like they're healthy, mental health is how we go about our day to day. We're in a good mood, we're in a bad mood. I'm stressed today, I'm not stressed today. It's your mood and how your mood impacts your behavior and your thoughts and how you cope with day-to-day stressors. When it becomes an issue is when you're unable to use whatever strategies, coping skills you've developed to address those challenges. And if you think about it being on a continuum, any day you can be anywhere on that continuum, and you use your toolbox to move back to the middle of equilibrium. People with mental illness may have limited toolboxes, limited exposure to coping skills. They may also have chemical imbalances in the brain that impacts how they process information and think. And they may have experienced trauma to the extent that it impacts how they react and perceive the rest of the world. And so the other piece is when you talk about the coping skills, you cannot leave out the aspect of chemical or substance use disorders, because in some situations, those are actually self-medicating and coping skills for individuals who may have other issues that they're masking or trying to hide. So for me, and I think for the larger population, when you talk about mental health, most people really think about mental illness and what that looks like. And in our Black community, what we've seen as far as mental illness are things as small as family members or people in the community with small quirky behaviors, all the way up to the really intense psychotic individual who can sometimes be concerning to individuals or fearful for some folks.
So Charlie, I think that, what you said is really eye-opening, because you mentioned mental health as a continuum, right? And oftentimes there's a stigma around, getting help to aid in having good mental health. And one of the things that I've started to teach my daughters is healthy mind, healthy spirit, healthy body. Healthy mind is what a therapist can help you with, just to be proactive. And to your point, teach coping skills. Healthy spirit, if it's your preference, is around God and spirituality. And then healthy body ties to exercising and good eating habits. And I think that it'd be helpful for our audience to really understand that you don't necessarily have to have mental illness to be proactive about having mental health as well. Can you maybe speak to that?
Absolutely. That is an excellent point. And I think that is one of the biggest gaps for our community is that we don't seek help until we see people at that extreme. And in actuality, you mentioned the trifecta of health, right? Mental, spiritual, and physical. And what our community tends not to do is seek out preventative or maintenance type of activities or services that help us maintain that mental health and balance that out. Sometimes it's because we actually don't have access to it. Other times is, again, the stigma around it. Suck it up, I can deal with this. My aunt just died. Why am I not over this? My best friend died last year. I should be through mourning my best friend over last year. I'm just in a funk. Why can't I get out of this funk? And in actuality, those are signals to us. Just like if you were having a headache that didn't go away, what would you do? You would seek help. If you're in a funk that's not going away, or if you're anxious or losing your train of thought or frustrated or tearful, we have to step back and have some self-awareness to say, hey, this is really not normal. Maybe I do need to seek some help. And help doesn't mean you're crazy, which is the other piece of the stigma, right? It doesn't mean you are weak or your character is flawed. And that's the other piece that, thank God, is happening nationally and community-wide, is you're getting a lot of individuals who are stepping up to say, I see a therapist. Mm-hmm. Just like I see my annual PCP to do my physical, I see a therapist periodically to make sure I'm doing okay. And we've gotten athletes and actors and other prominent individuals to start really talking about that as being part of who we are, part of our whole self. For so many years, for so long, even in our treatment arenas, they cut the head off. And if you had psych issues, you went over here. And if you had physical issues, you were over here, and you couldn't get treated in either setting until one was resolved. So now we're really trying to look at integrated care and holistic care and treat the whole person, because believe it or not, 68% of individuals who have serious mental health illness have medical comorbidities, because they're a vulnerable population and they either don't have the resources or the support to get the care that they need. Flip it to the other side, 33% of patients with physical, especially chronic illnesses, have some type of coexisting psychiatric issue, mainly depression and anxiety. You have a heart attack, you know what the main additional diagnosis is? Depression, right? Diabetes, depression. Well, just like we work with diabetes, you go to your doctor, sends you to a specialist, the specialist works you up, gets you with your diabetic regimen. You have a role in being educated and maintaining your diabetes. You know how to do your checks. You know how to administer your medication. You know how to eat right. You know how to exercise right. We need that same model for mental health. You know how to cope. You've got coping skills. You know signs and symptoms of when you're struggling, when you have anxiety or depression, early warning triggers. And so as we move towards eliminating that stigma, we also need to help support our communities in balancing out access to care and treating mental illness like we treat physical illness, and also treating them all together so that it's not separate. Again.
Exactly. Oh, sorry, Charlie. That's actually a great segue into my next question, which is, what are the biggest barriers to Black people seeking mental health professionals? Because you said access is key. What are our barriers?
Acknowledging that you need help is a big one. We go to girlfriends first, and sometimes girlfriends aren't necessarily the best therapists. Sometimes they are, but sometimes they're not. We push it down and ignore it until it gets so severe that we don't do anything about it. We pray it away. And so there has to be a balance with our religion and our spirituality, with understanding that one does not exclude the other, and you need both for good mental health. And to acknowledge that mental health is it's a disease of the brain. You're not possessed by a demon. It's not about living your life right. If you truly have a mental health condition, you need medical treatment or therapy to treat that, to move you to the next stage. And then, the social economic aspect, we have to look at insurance and the quality of insurance we have. We have to look at even our behavioral health providers and who they are and what they look like. Many times, and I can tell you, I've experienced this with my daughter. She was diagnosed high functioning autism. And the first few therapists she had, she clicked with, but I had issues with, because I didn't think they really understood the cultural implications of what we were dealing with. Then we had a foreign physician who was very judgmental, in my opinion, and just felt that as an African American, we were spoiling her, and we needed to have her be more accountable. And then finally, I found an African American male psychiatrist who is the perfect fit, who understands all of the social dynamics, who understands our community dynamics, who is close to just a little bit younger than I am. So that generational difference of how you were raised as opposed to how you raise children today, and then add the expertise of working with someone with autism who is very intelligent. That took me 4 years to find that therapist, and I'm in the system. So if you're not in the system, just think how challenging that can be to find someone who you're comfortable with. That's really a challenging issue. Now, what I will tell you is that there's been some legislation recently that for those individuals who do have resources will help with behavioral health care, and that is called parity. And what it says is if you have medical health care coverage and you have behavioral health care coverage, that they have to be equal. Historically, what you would see is behavioral health carve-outs, and then they would capitate services. You only have this many visits, you only have this many hospital days, you can only use these types of medications. Very much more strict than a medical condition being you needing a specific formulary. You have diabetes, these are our preferred diabetes drugs, you have to pass these or fail these before you get to this next level, that type of thing. Behavioral health was jumping through hoops even to get to that service, and then having limited services. So with the behavioral health parity law, people need to understand that if you have insurance coverage, you need to hold people accountable so that you have that access to those services. And then I strongly recommend looking for the community and the community African-American therapist. If you have insurance, you can Google the type of individual you want. Just like OBGYN, I asked for a Black female, I Googled it, and that's how I chose my OBGYN. I did the same thing for my psychiatrist because I know they have understanding and like experiences. And that was important to me. It may not be important to everybody. Other people may not need that level of connection. And there are a lot of initiatives around the therapy community having cultural sensitivity trainings and cultural awareness. It's the beginning. It's a drop in the bucket, but it's moving in the right direction.
Charlie, you hit it spot on. I did the same thing when I was looking for a therapist. I Googled Christian Black therapist, like very specific search terms, because, you know, when you're having those intimate conversations and unpacking things, you want to make sure that person understands kind of your background and that it's going to be culturally relevant. So thank you for sharing that.
Yeah, and another thing I feel like that you're highlighting is this need and idea for holistic care, where we're not just only caring for the physical body on, you know, a routine basis, but tending to neglect the mental aspects of our health. And that was a good point that you made earlier about just checking in, even when nothing's wrong, just like we check in for our physical body and our physical functions. Hardly ever do we really think about checking in mentally to see where we are. And so the other sort of the piece to that you spoke to was about some of the barriers that exist in trying to obtain that holistic care, especially with respect to the mental aspect. So can you speak to maybe some things when people don't have access to the Black psychiatrist or don't have access to adequate health care that allows them to be able to search for particular psychiatrists, or maybe even get services when you don't have access to these resources, you don't have direct access to the Black psychiatrist, or you don't have access to adequate health care that allows you to be able to obtain those mental health services. What are some things that people can do when you don't have those professional resources?
So I am actually on the board of NAMI, which is the National Alliance for on Mental Illness for Greater Houston area. It started out as a grassroots organization. There's a state level authority as well as national level. And NAMI actually has support groups free of charge. And you can go on the website, namigreaterhouston.org, and look at the support groups and register and join support groups. And those support groups can be peer-to-peer, where individuals who feel like they may have some issues can participate. There's family support groups, because I think one of the unique components of behavioral health is how it impacts the family, and how in most recoveries and treatments, the family is really involved or either very much impacted, and so they need some support. NAMI also does a great job with doing some education. There's some great initiatives around school education, provider education, so that providers can understand what patients and families go through within the system when they seek care. There's crisis intervention phone lines with NAMI. There's also an array of safety net services within Houston. Harris County, Harris Center, it used to be Harris County MHMRA, it's now Harris Center, has a crisis emergency room located on Ben's Taub's campus, but it's separate from Harris Health System. They have outpatient clinics that individuals can access also, that work on a sliding scale based on income care. And they tend to have a a full spectrum of services. Unfortunately, what happens is we see patients and families present in the emergency room when they're more chronic. So it takes a little bit more work to get them out of that acute care phase into recovery phase. There are some other community facilities that have mental health services. What I'm seeing through NAMI is the start of some good collaborations with some of our religious entities, some of our churches, in being able to start talking about the awareness of behavioral health and even being a site for some support groups or joining in some initiatives on some education for their church members.
Is it safe to say that there's likely a model similar to what you're describing in like most cities?
Yes and no. I think that Houston has some strengths that grew out of necessity and some collaborations, especially when you look at the safety net collaboration between Harris Center, Harris Health System, and Harris County Psychiatric Center. I would add our constables, our Harris County constables in that, just because of the unique nature of our large uninsured population, and knowing that the longer you go without services, again, the more acute you present, and use those intense services, which really transverse all three of the areas, from going to an emergency room and being stabilized there and discharged to outpatient services, to go into an emergency room and going to a hospital voluntarily, to being taken to an emergency room on an involuntary basis and needing court-ordered treatment. The sheer volume that we deal with in Harris County is large, and we did not expand Medicaid, which also is a limiting factor to individuals being able to have enough resources. When you look at other states and other cities that did expand Medicaid, as I mentioned before, if you have medical insurance, you've got to have health parity. So it also extended their coverage for mental health services and then access for those mental health services. The other thing about Harris County is, although we're an urban area, if you look at our population growth, our service platform, the growth has lagged behind the population growth. So we don't have enough of the public services that we need. That is changing. Harris County Psychiatric Center is actually in the process of building more acute services, and Harris Center has done a fabulous job of expanding access to outpatient services and outpatient groups. So the organizations, our county structure really tries to work well together to make a way out of what we have.
But we could, because I was going to ask a similar question as to what Mila asked. Out of Houston, there might still be some hotlines, community centers, churches that might have certain counseling available that might or might not necessarily be spiritual or not. Correct? Would you say
that's correct?
Available in most areas?
Yeah, that is correct. So NAMI has a crisis hotline, and they can direct individuals to the right level of care. Even the United Way, believe it or not, has some access to resources that they can direct individuals to.
Well, Charlie, this has been an amazing discussion. We have got to bring you back to the show as a follow-up, because we have a lot to unpack. We really want to help our community. Our goal here at the Black Scientists Cooperative is to make data simple and educate our viewers around the science behind the healthcare so that they make better decisions. This being one, get you some help. There's nothing wrong with it. And so we'd like to thank you for joining us this evening, and I hope you'll join us again.
I definitely will. And for those that are in the Houston area, NAMI Walks 2021 is May 22nd. So help us continue to stop the stigma and bring awareness to mental health. So let's continue to work on mental and physical and holistic and spiritual health for everyone. And then you think about having me back in October, because that's depression, the month for depression. So.
Amen to that.
All right.
I really appreciate it and enjoyed it.
Thank
All right.
you so
Thank you.
much. See you guys next time. Thank you for listening
Bye-bye.
to Black Scientists Cooperative Podcast.
Deep flows like a breeze flowing through me, from my head to my feet. Your love runs smooth, ooh, it soothes, and you're making life right. I'm so glad that you're mine. You're mine. Yeah.